Hello, fellow microbiome classmates. My name is Kate Wright, and today I wanted to discuss brushing away pregnancy complications, how treating the oral microbiome with care can limit pregnancy risk factors. Before we get into the nitty-gritty of the presentation, I want to begin by asking a question. How many of you knew that you're actually supposed to floss before brushing your teeth? Yeah, I didn't know this either. Not until I went to a brand new dentist 3 months ago. Before going to that dentist, I didn't really understand what impact my oral microbiome could have on the rest of my body. After I sat in the waiting room for a little while, I saw on the wall a pamphlet that said, "Pregnancy." I'm at the dentist's office. I'm thinking, what does anyone's mouth have to do with pregnancy? It turns out how a pregnant woman treats her oral microbiome impacts not only herself, but also the baby inside her. Now that was enough to grab my attention. Whether you will be personally affected through having a child yourself or indirectly affected through pregnancy of a loved one, it's important to understand that changes to oral microbiota during pregnancy can negatively impact not only the mother's overall health, but also that of the infant. According to one article by Sandawi and colleagues, the oral cavity contains the second most complex microbial population within the human body with more than 700 bacterial organisms. Some of you listening may have experienced some of the challenges to maintaining a healthy oral microbiome and experienced cavities or periodontal disease. In the case of pregnant women, this challenge becomes increasingly more difficult. Dr. Shahanigan, a board-certified pediatric dentist from Rady's Children's Hospital, notes that during pregnancy, excessive bacteria grow in your mouth and can enter the bloodstream through your gums and travel to the uterus. This triggers the production of chemicals called prostaglandins, which can induce premature labor. Additionally, in a 2024 study by Jang et al., it is noted that women who have periodontal disease during pregnancy are at a higher risk for delivering preterm and low birth weight infants. Their research shows this bidirectional relationship between oral microbiota and pregnancy. What this means is that when there is a dysbiotic oral microbiome, there is a higher risk for pregnancy complications. And on the other side of that, hormone fluctuations and immunological changes can impact what bacteria are doing in the oral cavity. So we know that this happens and the negative effect oral microbiome dysbiosis can have on the infants. But what can be done to protect and positively impact the maternal oral microbiome? I've listed a few ways here on the screen, but it's important to note that it's not all inclusive here, but rather just some actionable highlights. Benselmane and colleagues emphasize the need for vigilant clinical oversight throughout pregnancy, as it's crucial for establishing appropriate benchmarks for maternal health. Dr. Shahanigan recommends flossing then brushing daily and also eating a healthy diet to promote a healthy oral microbiome. The last method I want to discuss is with the use of probiotics and prebiotics. The study that investigates the use of probiotics and prebiotics is Manipulating the Diseased Oral Microbiome, the Power of Probiotics and Prebiotics by Yu and colleagues. For the context of this study, probiotics refers to the beneficial use of live bacteria, and prebiotics are growth-enhancing compounds. This study argues that these probiotics work to reduce karyogenic organisms like S. mutans via competitive inhibition. Some of the bacteria used include Lactobacillus lactis and Bifidobacterium, and have been shown to decrease S. mutans persistence. For prebiotics, this study suggests that the amino acid arginine can be utilized by bacteria to help balance out the oral microbial populations. It was shown that toothpaste supplemented with 1.5% arginine promoted a favorable compositional shift from bacteria that contribute to plaque buildup to ones that don't. If you leave this presentation with nothing else, remember, take care of your oral microbiome and it will take care of you. Thank you for listening. These are the articles that I referenced during my presentation. I hope you all enjoyed. Thank you.